We're still yet to get to the bottom of the Slack fiasco last month that led to thousands of Australian cruise boat passengers to disembark in Sydney without proper health checks. And as we now know, more than 10% of Australians' infections have arisen from the one ship, the Ruby Princess. A little less than 400 have been infected from the Ruby Princess. 5 people are now dead. More than a quarter of our total infections have come from cruise ships. But in reference to the Ruby, it's gone viral, all right, because New South Wales Health deemed the passengers low risk. Some they knew had flu-like symptoms. So where's the investigation into this gone? And if the cruise ship debacle is a prime case of how to shoot the nation in the foot in the middle of a pandemic, which it definitely has done, the same has to be said for the way New South Wales Health has handled one of the prime fatal clusters. This deserves an investigation too. I'm referring to the Dorothy Henderson Lodge at Macquarie Park in Sydney, where 5 residents have died. Now, bear in mind, the first death recorded at the lodge was back on March 3. I then had messages sent to me from family members, which I told you about, complaining about why tests weren't done on all the residents at that time. The next death at the lodge came on March the 6th. Still no widespread testing. Family members were getting increasingly frustrated. The third death came on March 14. Still no testing of all the residents until March the 20th, which found that 4 other residents had the virus. 5 staff have been infected as well. The 4th death came on March the 27th and the 5th yesterday. How, after 3 deaths in the one home, do you still then wait almost a week before conducting tests on all residents? It should have been done after the first death a month ago. That's what the family said to me, or at least after the second. If the handling of the health issues related to the Ruby Princess is a stuff-up, this rate's right up there. 5 people have died there as well. The Premier should be taking the kid gloves off her and basically giving her Minister, Brad Hazzard, what for. And Brad Hazzard, as we know, protects his department beyond what it deserves. And I should point out, hardly a question has been asked by the media about the way health officials have dealt with the cluster and testing at this aged care facility. Hardly a question at all. Those elderly people who are no longer with us deserve more, as do their grieving families.